More than 24,000 vaccine doses have been administered in the Niagara region. The groups given the shots include long-term care home and high-risk retirement home residents, as well as frontline healthcare workers. So when will the rollout expand to others? Joining us now is Niagara's Medical Officer of Health, Dr. Mustafa Hirji. Thank you for joining us.
Thank you for having me.
Dr. Hirji, when will the Niagara region begin to vaccinate those in the Indigenous community and people 80 years and older?
Fortunately, it's going to be very soon. We're actually beginning work on vaccinating the Indigenous community starting next week. Over the next couple of weeks, we're going to be vaccinating people in retirement homes that we haven't got to yet, in shelters, the homeless population, the Indigenous, as well as other congregate settings with seniors. And then in the latter part of March, we'll be vaccinating the 80-plus group.
Okay, so we don't have an exact date yet.
The province has said those vaccinations should start the week of March 22nd, and it'll be that week we start.
Okay. Well, how will people be informed when it's their turn to get vaccinated?
We're going to be getting that message out to every avenue possible to us through media, through advertising, social media, through our social services and healthcare partners to let those populations who are 80 years of age and older know it's their turn to start registering. And that'll actually probably be happening near the end of next week in time for the province's registration systems rollout on March 15th.
Now, are you satisfied that you have a good supply of vaccines going forward?
The province is promising us that they've set that timeline of starting vaccinations for the 80-plus age group on March 22nd because they're very confident the vaccine supply will be there for that time. And so we're basing our confidence on their confidence.
Well, just about an hour before our show, we learned the National Advisory Committee on Immunization is recommending a 4-month period between the first and second doses of the vaccines. How will that impact the rollout in Niagara?
What I think this means is that it's actually good news for lots of people in that they'll be able to get their first dose of vaccine a lot earlier. Instead of coming back 3 to 4 weeks later to give that second dose, we'll be able to use those doses as new first doses for additional people. So we'll actually be able to vaccinate a much larger group of the population with a first dose and get a lot more protection out in the community.
That's good to hear. And yesterday, a national advisory panel advised against giving people aged 65 and older the AstraZeneca vaccine. Today, Solicitor General Sylvia Jones said the province plans to give it to people aged 60 to 64. Where do you stand on the issue? Do you have any concerns?
Yeah, I think the National Advisory Committee on Immunizations are the experts at this. They've looked at the science and they've concluded that for the elderly population over 65, that vaccine is not as good as the Pfizer and Moderna vaccine. So I think it makes a lot of sense to reprioritize that vaccine to other age groups who are younger than 65. And if we're going to have a speedier vaccine rollout now with only giving 1 dose up front and delaying that second dose, I think there's a lot of opportunity now to actually vaccinate a lot of other people.
All right, thank you, Dr. Hirji. Dr. Mustafa Hirji is Niagara's Medical Officer of Health.